All right, joining us on the broadcast, we have a panel of experts to make sense of India's surge in COVID-19 infections and also the latest as far as the AstraZeneca vaccine is concerned. Dr. Mufazzal Lakdawala, Director of Surgery at the Reliance Foundation Hospital in Mumbai, joins us. We also have Dr. Avinash Phonbe, former president of the IMA in Maharashtra, and we have Dr. Rajinder K. Dhameja, professor and HOD of Neurology, Lady Hardinge Medical College in Delhi. He's also a member of the AEFI committee, which is the Adverse Events Following Immunization Committee for COVID-19 vaccine. Thank you all very much for being with us. Dr. Dhameja, I want to begin by asking you, you're on the committee that follows adverse effects after immunization for the COVID-19 vaccine. I want to first begin by asking you about the safety of the AstraZeneca vaccine. There are 4 countries that have temporarily suspended the use of the vaccine, fearing blood clots. Now, this is, of course, the vaccine that's known as Covishield here in India and is being widely administered.
Thank you, Rishika, for having me on the show. It's always a pleasure. There are strict safety monitoring protocols in India for the vaccination campaign. So there are state level committees, there are district level committees, and there's national level committees. So I'm one of the members. I'm in one of these committees. So obviously we are looking at every monitored side effect which are reported to us, and so far we have not come across any major side effects. Leave apart the thromboembolic phenomena, what we are talking about, deep vein thrombosis or pulmonary embolism. No death has been reported to us so far linked to any of these vaccines. So obviously the 30 cases which have been reported all over the world, we don't know the cases. What are their age profile? What is the risk factors, underlying conditions, comorbid conditions? Why did they have this DVT and pulmonary embolism? So it looks like that it is not linked to the vaccine. It could be otherwise also.
Right.
There is data of 10 million cases. In India also we have millions of cases being given jab of COVID-19, the Covishield vaccine. So obviously this is not a matter of concern to us, and we should continue to aggressively vaccinate given the surge and the impending second wave as of now you're talking about.
All right. I think this is very important clarification, Dr. Dhameja, that you're making, that there is a whole host of factors that actually need to be investigated before one can arrive at the conclusion that the vaccine is indeed not safe. So the vaccine is safe. It is widely being used, and AstraZeneca and the World Health Organization have both come out and said that. Now I want to shift our focus to the other aspect of today's discussion, which is, of course, the worrying surge in COVID-19 infections. Dr. Mufazzal, if I can come to you at this moment, as someone who is, you are a resident doctor in Mumbai, I want to understand from you, what explains this surge in Maharashtra? On a daily basis, we're seeing cases in Maharashtra continue to rise. Are you at all worried about variant strains that we are perhaps not being able to identify effectively?
Good morning, Rishika. I mean, it would be stupid to say that nobody would be worried with the rising cases. I think everyone, including the government, the citizens, the doctors, everyone from the frontline workers should be worried. I believe that the biggest reason for this massive surge suddenly, or this second wave that we're talking about, is probably something that I call as corona complacency, lack of corona fear, and just the attitude, ke chalta hai attitude that we have in India, that so many people have survived. The fear of corona is gone. So let's go out and live our lives. The government had to open up the cities and the states because the economic condition was worsening. And given this careful opening up, people have let go of all the precautions. People don't wear masks. People have let go of social distancing. And once vaccination has opened up, people believe that once they've got one jab, it's as good as they can walk around without a mask and do whatever. So I think it's just...
But Dr. Mufazzal, Dr. Mufazzal, the reason I ask you this question specifically pertaining to variant strains is because Maharashtra is seeing a disproportionate rise as compared to other states. The numbers are rising pan-India, but it is over 50% of India's cases at the moment, or our daily case tally is because of Maharashtra.
Like I've said before, that Maharashtra was one of the first states to shut down its borders. Unfortunately, we have very porous borders. So people have used this stupidly to try and come into Maharashtra from various sources, either by land or via landing in different parts of India and entering Maharashtra. So it's very difficult to kind of control this behavior from people when they are irresponsible and cause infections to other people. I think talking about different strains, we need to understand that, yes, there is the Kent strain, which is highly infectious, which has come into India now. A lot of cases have been picked up. But most importantly, if we were to isolate ourselves, if we were to be positive with symptoms, I think we would be able to control this.
Right. Dr. Avinash, would you agree that, there is COVID complacency and one is witnessing that firsthand? If you just step out of your homes and enter into a market, mask compliance has gone down. But what explains the disproportionate rise in cases in Maharashtra vis-a-vis other parts of the country?
Rishika ji, thank you very much. This rise itself explains that this is something big. If you look at with analysis, that the number of cases in Maharashtra are increasing. Yesterday, the rise was 15,817.
Yes.
And if you see that 90% of the cases in these are asymptomatic. Most of them, 80% of people are from 20 to 40 years age group. The death rate is still there. It means that it has changed its this thing, that it is very rapidly increasing, but the asymptomatic patients are increasing. We have been observed that there are some symptoms like nausea, vomiting, and anosmia, that is lack of smell. These type of symptoms are increasing, and there is every chance to think that this is a mutant or variant virus which has evolved itself in Maharashtra. If you see, Maharashtra has, right from the initial period, it's been the highest number of cases are there. And so we must think that it is some mutant which originated in Maharashtra itself.
So you're saying that there is a possibility of a mutant strain spreading in Maharashtra?
Yeah, and unfortunately there is no specific research or observation, or nothing is done like genome sequencing to prove that, to rather disprove that it is not Maharashtra state. Only the statements are being made. But if you observe, if you compare it this as a sudden rise in Britain, in England in December, it is just a similar thing.
Well, absolutely. And it all started like this even in Britain in September. You're absolutely right as far as your assessment is concerned. The question is, are we doing enough to be able to contain these mutant strains? Dr. Dhamija, I want to also ask you about Delhi, because while, of course, Maharashtra is the big focus with the restrictions that have been put in place, lockdowns in select areas that have been put in place. I want to ask you about Delhi as well, because even in Delhi, we're seeing over 400 cases. Punjab is seeing an exponential rise as well. The Health Ministry has issued an advisory for Delhi NCR to be watchful about the rise in cases as well.
Absolutely, Rishika. If you see over last 3 weeks, in fact, from the 1st of March, a week earlier also, the trajectory of 7-day average has been rising in Delhi. So it's more than double now, from 200 to 431 cases last year in last 24 hours. And this is a surge which we have been worried and we have been talking since last June that this will come in multiple waves, and this is the either you call it third wave or fourth wave, but definitely it's a multiple waves. So what I need to tell you is that what we should do actually, and the pandemic is not over actually, it is still there, and the virus is not gone. The vaccine has come, the new year has come, but the virus is still around us. So what we need to focus on aggressive contact tracing now, 30:1 or 15:1.
So aggressive contact tracing, and as many have said, even quarantine, reinitiate the process of institutional quarantine in pockets where the virus is spreading rapidly. Dr. Mufazzal, Dr. Mufazzal,
just one second, I'll just take 30 seconds. Not only the aggressive tracing, but aggressive testing and opening up the vaccination. So now the people less than 45, they are the one who are moving around most of the times and spreading the infection. So we need to focus on that also. And the fourth one is avoid these large crowds, gatherings, and all these the events. So that is also the fourth thing which we should be done immediately.
Well, absolutely, and perhaps a more liberalized norms for vaccine may actually, increase the vaccination numbers. But Dr. Mufazzal, quick last question to you. Many say that the upward trajectory of COVID-19 cases in India once again could in fact be the onset of a second wave. However, thankfully, so far, the uptick in cases is not being met with an uptick in the number of deaths. Is the second wave, therefore, going to be less dangerous? Can we say that?
It's too early to say this, Rishika. We do not yet know. Most of the deaths initially happened because the healthcare systems were overburdened. My biggest fear is that today we've got some kind of corona fatigue. The healthcare systems have been overburdened for quite a time now, for more than a year. If, God forbid, these numbers were to continue to rise and these healthcare systems are again overburdened, I would shudder to think what would happen. So let's not be complacent. Let's try and completely try and control this second wave, if there is any. Contact trace, like Doctor said, actually go out and aggressively look for the positive spreaders and try and stop this right here and right now.
All right, I think that's very crucial advice as far as our doctors are concerned, that this surge has to be stopped in its tracks right now. And of course, it is up to each individual as well. You have to continue to wear your mask, maintain social distancing, and be responsible if you do test positive for the coronavirus. Thank you so much, doctors, for sparing your time early on Saturday morning and joining us with your perspectives. Thanks very much.
Thank you. Thanks for having me.